Sarah Chen never wanted to be a paramedic. She'd planned on becoming a nurse, maybe working in a quiet suburban hospital where the most dramatic case would be a broken arm or an elderly patient with chest pain. But life had other plans, and by 1994 she found herself working for Seattle Fire Department's emergency medical services, responding to overdoses, stabbings, and car accidents in the grittiest parts of the city. What she never expected was to become intimately familiar with the address 4528 8th Avenue NE, a modest apartment building in the University District. What she couldn't have imagined was that over the course of 8 years, she would be called to that address 14 times to save the life of one of rock music's most iconic voices. The first time we got a call to that apartment, I had no idea who Layne Staley was, Sarah recalls, sitting in her Seattle home 21 years after her retirement. To me, he was just another overdose victim, patient 47 on a Tuesday night shift. But by the end of my career, saving Layne Staley had become almost routine, too routine. Sarah Chen's story is one that has never been told publicly. Bound by HIPAA regulations and professional ethics, she kept silent about her repeated encounters with the Alice in Chains frontman for over 2 decades. But with Layne's story now part of public record and her own battle with PTSD from years of trauma response, Sarah has decided it's time to speak about the 14 times she helped bring one of music's most tortured souls back from the brink of death. November the 23rd, 1994, 2:47 a.m. Sarah was 6 months into her career as a paramedic when the call came in. Unconscious male, possible overdose, 4528 8th Avenue NE, Unit 301. It was Thanksgiving week, Sarah remembers. I was working the graveyard shift with my partner, Jake Morrison. We'd already had 3 overdose calls that night. It was typical for the holiday. People use drugs to cope with family stress, loneliness, all the emotions the holidays bring up. When they arrived at the University District apartment building, they were met by a frantic young man who identified himself as Mike. He was pacing back and forth, clearly panicked, Sarah recalls. He said his friend was really bad and that he'd been trying to wake him up for 20 minutes. That's actually not that long in overdose terms, but you could tell this guy had never dealt with anything like this before. Sarah and Jake followed Mike up 3 flights of stairs to a modest 1-bedroom apartment. What they found inside would be the first of many similar scenes. The patient was lying on the bathroom floor, unconscious, barely breathing, Sarah describes. Pale, clammy skin, blue lips, pulse barely detectable, classic opioid overdose presentation. Next to him on the floor was drug paraphernalia, needle, spoon, lighter. Following standard protocol, Sarah immediately administered Narcan, naloxone, while Jake established an IV line and monitored vital signs. The response to Narcan was dramatic, Sarah recalls. Within 60 seconds, his breathing improved, his color started coming back, and he began to regain consciousness. It's always remarkable to see someone literally coming back from the edge of death. When the patient fully regained consciousness, Sarah was struck by his piercing blue eyes and long blonde hair. He looked at me, and the first thing he said was, "Did Mike call you?" When I said yes, he seemed relieved. Then he asked if we had to take him to the hospital, which is typical for overdose patients. They wake up feeling fine and don't understand why they need medical evaluation. Sarah explained that hospital evaluation was mandatory after an overdose, and the patient complied without argument. He was polite, cooperative, seemed genuinely grateful, Sarah remembers. He thanked us multiple times during the transport to University of Washington Medical Center. I remember thinking he seemed like a nice kid who'd made a bad decision. It wasn't until they were filling out paperwork at the hospital that Sarah learned the identity of her patient. The triage nurse saw the name and asked if it was the guy from Alice in Chains, Sarah recalls. I had to ask her what Alice in Chains was. I wasn't really into that type of music, so the name meant nothing to me. That first encounter seemed routine, a young man who had experimented with dangerous substances and nearly paid the ultimate price. Sarah assumed it was a one-time event, a wake-up call that would steer the patient toward better choices. She was wrong. The second call to 4528 8th Avenue NE came just 6 weeks later, on January 9th, 1995. Same apartment, same patient, same life-threatening overdose. When we got the call and I saw the address, I had a sinking feeling, Sarah admits. Repeat overdose calls to the same address usually mean one of two things. Either you're dealing with a drug house, or you have a patient who's developed a serious addiction problem. This time, they were met at the door by a different person. A tall, thin man with shoulder-length hair who introduced himself as Jerry. Jerry was more composed than Mike had been, but you could see the worry in his eyes, Sarah recalls. He said, "He's done it again." Like this was becoming a pattern he was starting to recognize. The patient presentation was nearly identical to the first call: unconscious, compromised, breathing, drug paraphernalia nearby. But Sarah noticed some differences. "He looked thinner than he had 6 weeks earlier," she observes. "And when he came around after the Narcan, he seemed less surprised to see us, like he'd been expecting this to happen." During the transport to the hospital, the patient, who Sarah had now learned was named Layne, made a comment that stuck with her. He said, "I guess this is going to be a regular thing now," Sarah recalls. "At the time I thought he was talking about needing medical attention. Looking back, I realize he was predicting his future." Sarah tried to use the transport time for patient education about overdose risks and addiction resources. "I told him about needle exchange programs, about methadone maintenance, about counseling services," she says. "He listened politely and said he'd look into it, but I could tell his heart wasn't in it. He was going through the motions of caring about his recovery because that's what he thought I wanted to hear." The third call came 2 months later, then a fourth 3 weeks after that. By the summer of 1995, Sarah had responded to 6 overdose calls at Layne's apartment. It was becoming clear that we weren't dealing with recreational drug use gone wrong, Sarah reflects. This was full-blown addiction, and it was escalating quickly. By 1996, Sarah had responded to 10 overdose calls for Layne Staley. What had started as routine emergency medical care had evolved into something more complex, a professional relationship built around crisis intervention. When you save someone's life that many times, you develop a connection, Sarah explains. Not friendship exactly, but a kind of understanding. Layne started recognizing me, remembering my name, asking about my life during transports. Sarah noticed changes in Layne's condition and behavior with each successive call. He was losing weight rapidly, she observes. Each time I saw him, he looked more fragile, more hollow. His arms were covered with track marks. His veins were getting harder to find when we needed to start IVs. More concerning was the pattern of his overdoses. They were becoming more frequent and more severe, Sarah notes. Early on, he would respond to Narcan within a minute or two. By 96, sometimes it would take multiple doses and several minutes before he regained consciousness. Sarah also began to recognize a cycle in Layne's behavior. He'd overdose, we'd save him, he'd be grateful, and promise to get help, she recalls. Then a few weeks later, we get another call. Each time, he seemed a little more resigned to the pattern, a little less hopeful about breaking it. During one transport in late 1996, Layne asked Sarah a question that haunted her for years. He said, "Sarah, do you think there's a point where someone is too far gone to be saved?" She recalls. "I told him that as long as someone was breathing, there was hope. But he just shook his head and said, 'I think I passed that point a long time ago.'" Sarah tried to maintain professional boundaries while providing emotional support during these conversations. "Part of me wanted to grab him and shake him and tell him to get his life together," she admits. "But that's not my role as a paramedic. My job is to provide medical care and transport patients safely. The counseling and intervention work has to come from other professionals." Through her repeated visits to Layne's apartment, Sarah became familiar with the small group of people who consistently appeared during his medical emergencies. Jerry was almost always there, Sarah recalls. He seemed to have appointed himself as Layne's unofficial guardian. He knew Layne's medical history better than most doctors, knew what medications he was on, knew which hospitals he preferred. Sarah observed Jerry's increasing desperation as the overdoses continued. You could see the toll it was taking on him, she notes. Each time we'd arrive, Jerry looked more exhausted, more defeated. He'd give us the medical update efficiently. When he'd found Layne, how long he'd been unconscious, what drugs might be involved. But his voice would shake. Other band members appeared at various calls, and Sarah witnessed their struggles with the situation. Mike Inez was there for several calls in the mid-90s, Sarah remembers. He seemed angry more than scared. Angry at Layne for putting himself in danger, angry at the situation, angry at feeling helpless. Sarah also encountered family members during her responses. Layne's mother came to one of the hospital visits, she recalls. This was probably 1997 or 98. She was obviously devastated, but trying to hold it together. She thanked me for saving her son's life, and I didn't know what to say because I knew I was probably going to have to do it again. The pattern that emerged was always the same. Someone in Layne's inner circle would find him unconscious, call 911, and then ride the emotional roller coaster of crisis, relief, hope, and eventual disappointment when the cycle repeated. These people loved him deeply, Sarah observes. But love isn't always enough when you are dealing with addiction. They were all trying to save him. But addiction is a disease that ultimately only the patient can fight. By 1998, Sarah's calls to Layne's apartment had developed an ominous quality. The overdoses were more severe, his recovery times longer, and his physical condition more concerning. Call number 11 was in March of 98, Sarah recalls. When we arrived, Jerry met us at the door and said, "I don't think he's breathing." That was the closest we ever came to losing him. Sarah found Layne in cardiac arrest, with no detectable pulse and no spontaneous breathing. We had to do full CPR, she explains. Chest compressions, advanced cardiac life support, multiple doses of Narcan, epinephrine. It took us almost 15 minutes to get him back. When Layne finally regained consciousness, his first words were different from usual. Instead of thanking us or asking if he had to go to the hospital, he looked at me and said, "Why did you bring me back?" Sarah recalls. That was when I realized we might be dealing with more than accidental overdoses. During the transport, Sarah tried to assess Layne's mental state. I asked him directly if he was trying to hurt himself, she says. He was quiet for a long time, then said, I'm not trying to die, Sarah. I'm just not trying very hard to live." This call marked a turning point in Sarah's understanding of her role in Layne's story. "I started to wonder if we were helping him or just prolonging his suffering," she admits. "Every time we saved him, we were sending him back to the same situation that had caused the overdose in the first place." Sarah consulted with her supervisor about the ethical implications of her repeated calls to Layne's apartment. "I asked if there was a point where we should involve adult protective services or mental health authorities," she recalls. But Layne was an adult who was conscious and oriented when he left the hospital after each incident. Legally, he had the right to make his own medical decisions, even if those decisions were self-destructive. The last two times Sarah responded to overdose calls for Layne Staley were in 2000 and 2001. By then, she was no longer surprised to see his address on her call sheet, but she was unprepared for how dramatically his condition had deteriorated. Call number 13 was in August of 2000, Sarah recalls. "When I saw him, I was shocked. He couldn't have weighed more than 100 pounds. His skin was grey, his teeth were in terrible condition, and his arms were so scarred from injection sites that finding a vein for an IV was almost impossible." This overdose followed the same pattern as the others, but Layne's recovery was slower and more concerning. He was confused and disoriented for much longer than usual after regaining consciousness, Sarah notes. "He kept asking where he was, what year it was. I was worried about brain damage from oxygen deprivation." During the transport, Layne seemed more vulnerable than Sarah had ever seen him. "He grabbed my hand and said, 'Sarah, I don't want to die like this,'" she recalls. "I told him that meant he needed to accept help, that there were people who wanted to help him get clean, but he just closed his eyes and said, 'It's too late for that.'" The 14th and final call came in February of 2001. Sarah arrived to find a scene that was becoming depressingly familiar, but with one crucial difference. This time, Jerry wasn't there. Sarah observes. It was just Layne, alone in his apartment, found by his landlord who had come to check on him after neighbors complained about noise. The overdose was severe, requiring multiple doses of, say, Narcan and aggressive supportive care. "His breathing was so depressed that we had to assist with bag mask ventilation for several minutes," Sarah explains. "His pulse was barely detectable, and he was hypothermic from lying on the bathroom floor for hours." When Layne finally regained consciousness, he seemed surprised to see paramedics. He said, How did you know to come? When I told him that his landlord had called, he seemed confused. He couldn't remember what had happened. Sarah recalls. This final transport was different from all the others. He was quiet the entire way to the hospital, Sarah remembers. Usually he would talk, ask questions, thank us. This time he just stared out the window. When we got to the hospital, he said, "Goodbye, Sarah. Thank you for everything." Something about the way he said it felt final. Sarah never saw Layne Staley again. 13 months later, his body would be discovered in the same apartment where she had saved his life 14 times. Sarah's repeated encounters with Layne took a toll she didn't recognize until retirement in 2003. After retiring, I started having nightmares about those calls. I'd give dose after dose of Narcan, do CPR, I'd try everything, but he'd slip away. I'd wake up, feeling like I'd failed him. Sarah sought counseling for PTSD and learned her experience wasn't unique among first responders. There's compassion fatigue in EMS. You feel hopeless, saving the same people repeatedly, knowing they'll end up back in the same situation. Sarah observed Layne's addiction progression over 7 years. Early overdoses seemed accidental. Later, the pattern suggested increasing tolerance or intentional self-harm. In 1994, he probably weighed 160 pounds. By 2001, maybe 100. Psychological changes were equally concerning. Initially, he'd be embarrassed about overdosing. By the end, almost detached from the whole process. Sarah's experience occurred during Seattle's heroin epidemic of the 1990s. The grunge scene coincided with increased heroin availability. Overdose calls spiked around album releases, concerts, tours. Through repeated calls, Sarah witnessed intervention attempts by desperate family and friends. There was one call where we found Jerry and others with treatment brochures spread on the coffee table. They'd been trying to convince Layne to go to rehab when he overdosed. Over the years, she saw fewer people at his apartment during emergencies. I think some reached a point where they couldn't handle watching him destroy himself anymore. Sarah reflects on what Layne's case taught her about addiction and emergency medical services. Layne's story taught me that addiction is a chronic disease requiring long-term management, not just crisis intervention. Every time we saved him, he got discharged to the same environment with no systematic follow-up. Sarah advocates for warm, hand-off protocols connecting patients immediately with addiction counselors. Today, Sarah works as an EMS consultant, developing better protocols for addiction emergencies. I can't save Layne anymore, but maybe I can help save others. Every time we saved him was the right choice. We gave him time to make music, connect with people. She keeps Layne's photo on her office wall. It reminds me every overdose patient is someone's child with talents and dreams. Layne's death wasn't inevitable. His story continues to inspire compassionate care that never gives up hope for recovery.